Most people want to know, is it really worth it? Will it make a difference? Hi, I'm Dr. Renata Harris, and I'm a cosmetic physician here at Reflection Center in Martinsville, New Jersey. And today I'm going to talk about filler and Botox for people over 60. Most people want to know, is it really worth it? Will it make a difference? Okay, so let's start with Botox. First, I would like to clear up what the difference is between Botox and filler. Botox uses a substance to temporarily make the muscles less able to contract very strongly. If you have a tendency to use certain muscles a lot, like constantly raise your eyebrows or constantly, scowl when you're talking to people, then over time this will cause etched in lines into your skin. Botox kind of makes the muscles that do that less able to do that, and that's how you can smooth the lines and wrinkles. If you have nice, plump, young, healthy skin, when you use Botox, even if you have some etched in lines, over time, even the etched in lines will get better as long as you kind of stay on top of your Botox. Once those etched in lines are very deep from years of repetitive motion, then it's much harder to erase them with Botox. You can smooth them, however, and over time, if you stay on top of your Botox, they will get better and better. You may not be able to get rid of them completely. So there are 4 situations where Botox doesn't seem to work as well, meaning that it doesn't get rid of your wrinkles completely. And the first case is kind of what I explained earlier. It's when you have those deep etched in lines that have caused like little creases and scars into the skin. For those people, Botox will not smooth that out completely. If you start early, before you have those deep creases, or if they're still very mild, then Botox will completely smooth out the lines over time. So the second situation is when people are not consistent with staying on top of their Botox. In most people, Botox lasts about 3 to 4 months. It kind of depends on your metabolism, how fast you break it down, and also how much you use. If you use more, it takes your body longer to get rid of Botox. Ideally, you would like to retreat when it's just starting to wear off, so your skin doesn't get a chance to be completely creased back by those overactive muscles. However, I sometimes have people who come in maybe just once a year or twice a year, before big events like the holidays or summer, and then if they let their Botox wear off completely, in that time in between, you kind of have to start back from scratch. And those people, it's going to be much harder to get rid of etched in lines. The third situation is for people who actually have developed antibodies to Botox, people for who Botox will not work at all. Sometimes this is spontaneously, sometimes this happens after they've done Botox a few times. It's very rare, we're not sure why it happens. If that happens, sometimes we can switch to a different type of Botox, which is either the brand name Regimen or Dysport. They use a slightly different molecule that the body doesn't recognize. Again, it's very rare, and I personally do not have any patients who have had that. We have a video that specifically talks about this, and there will be a link below this video in case you would like to know a little bit more about that. The fourth situation where Botox really doesn't seem to work for wrinkles is when the wrinkles are actually caused by laxity or volume loss and not overactive muscles. This happens a lot in the lower face or the radial cheek lines. That's not a muscle, that's just the skin that's kind of sagging down that's causing these lines to appear, and in that case, you can't use Botox to improve that. Once you have etched in lines that do not improve much with Botox, there's different options to treat that. You can do things to improve the skin quality like laser resurfacing or RF microneedling or soft wave / Ulthera. Usually we use energy-based devices to improve the skin quality. You can also use fillers that work as a biostimulator to help the body create more collagen, like for example Radiesse or Sculptra. In addition to that, you can also use fillers to replace volume loss and kind of prop up, kind of expand the skin. And you can imagine that if you stretch the skin out a little bit, you can help smooth some of those wrinkles that way. It's something that works, for example, really good. The forehead, when people have those deep etched in lines that do not go away with Botox and they have a very flat or sometimes even concave forehead, if you put filler underneath there, you can really help to improve the skin appearance by kind of stretching out the skin there and making those lines look a lot better. So next, I want to talk about fillers, and there's two types of fillers. There's hyaluronic acid fillers, which are made out of a sugar molecule that everybody has in their skin and subcutaneous tissue. It's a gel that you can use to replace volume or create volume. And then there's biostimulators like Sculptra and Radiesse that are more used to make your body make new collagen in the area that you place it. Usually when we're talking about fillers, we're talking about HA or hyaluronic acid fillers. So most people in their 60s will have significant volume loss in their face, and usually that's a combination of fat loss and bone loss, especially along the jawline. People don't realize, but their jawbone literally shrinks to half the size that it is when they're 18 years old. And that slowly happens over time. It starts in your 40s, but you can really notice it in your late 50s and 60s. So a lot of times you're gonna need a lot of filler to try to compensate for that volume loss, and it may not always be cost effective to do that. However, for people who absolutely do not want to do surgery, it would be a good way to improve their appearance. Most of the times you treat different areas of the face. You can treat the upper face, which is the forehead and the temples. You can treat the mid face, which includes the cheek and the under eye area. And then you can treat the lower face, which is the chin and the whole jawline. You don't have to do everything all at once. You can do it in stages. And most of the time, for my patients in their 60s, I recommend to do filler in combination with biostimulator fillers and energy-based treatments so they can get an overall improvement, because just filler alone will probably not do it. So there are a lot of different options for people 60 and over, and it's important to go to somebody that has experience with all these different options and can have a conversation with you about what would be the best plan for you. If you would like to know what would be your best option, I invite you to come to our office for a free consultation with either me or any of our other physicians so we can examine you and lay out the different options of what would be the best plan for you.